Hello dear viewers, today in this video which is part 2 on nutrition support in critically ill adults, I will discuss the nutritional support of those patients who were adequately nourished prior to becoming critically ill. Nutrition in critically ill patient is part of comprehensive management rather than considering it simply a supportive management because it impacts the outcome. I am Dr. Sunil Garg from Essentials of Acute Care. Generally, enteral rather than parenteral feeding and early means within 48 hours rather than delayed support is preferred. Enteral feeding is a common mode of nutritional support unless contraindication exists. For patients, when there are no contraindication to enteral nutrition, early enteral nutrition is preferred over delayed therapy. The support for early enteral nutrition is derived from evidence in critically ill patients that supports a possible mortality benefit and reduction in infection when early enteral nutrition means when the nutrition is started within 48 hours enterally is compared with delayed enteral nutrition. However, the evidence for this approach is limited, often conflicting and lower quality for patients with medical conditions compared with surgical conditions like patients with trauma, peritonitis, pancreatitis and burns. Means possibility of benefit is more likely in surgical patients than medical patients. Very early and aggressive feeding does not appear to be of benefit and may be harmful. So what is the meaning of very early and aggressive feeding? It means within 6 hours of hemodynamic stability, and aggressive means try to achieve more than 75% of the enteral nutrition goal initially. For patients who do not meet their caloric and protein goals during the first week of critical illness, administration of supplemental parenteral nutrition in order to reach caloric goals is not suggested since it does not alter outcomes. For adequately nourished patient with contraindication to enteral nutrition, early parenteral nutrition means starting within 36 to 48 hours rather than delaying nutrition is suggested. This approach is based on indirect data suggesting that when parenteral nutrition is administered in the short term, means in the first week of critical illness with a view to transitioning to enteral nutrition later, outcomes are the same as patient receiving early enteral nutrition. It is unknown if this recommendation applies to patients who cannot transition to enteral nutrition and have a potential need for the parenteral nutrition beyond the first week of critical illness. While delayed parenteral nutrition was preferred in the past, data now suggests that provision of early parenteral nutrition means up to 48 hours from the start of critical illness or surgery does not alter mortality when compared with either early enteral nutrition or late parenteral nutrition. For most adequately nourished patients who have a normal body weight, means body mass index between 18.5 to 24.9, or who are overweight, means BMI between 25 to 29.9, use the current weight as a dosing weight and which is dry body weight of an individual. Target for 25 to 30 kilocalorie per kg, 1.2 to 2 gram per kg of protein per day, and the recommended daily allowances of electrolytes, vitamins, minerals and trace elements. Initiate feeding at 10 to 15 kilocalorie per kg of dosing weight per day and slowly increase to the target over the ensuing 3 to 7 days. Using indirect calorimetry to measure resting energy expenditure, hence caloric requirement is impractical for most settings due to the cost of equipment and maintenance of expertise. In critically ill patients, prescription of 1.2 to 2 gram per kg of the protein per day is suggested. For most patients, amounts on the lower end of this range are sufficient, while patients with the severe burns, trauma or obesity may benefit from the amount on the higher end. Patients with kidney disease should have reduced amount of the protein since data suggest potential harm. Here I finish and I will continue with nutritional support in critically ill adults in my next video. If you have any feedback, suggestions or comments, please write down in the comment section box. Till then, bye and take care.